Hello and welcome to a special edition of Interviewers Irene. Today my guest is Dr. Supriya Mehta from the University of Illinois in Chicago. She's an associate professor of epidemiology, and we will be discussing the COVD epidemic, the corona problem, and what are the important measures? What are the guidelines given by the CDC important to follow in this case? So thank you, Dr. Mehta, for joining us today.
Well, thank you for inviting me to talk with you and with your audience.
We appreciate it greatly. So, one of the important guidelines to follow is to wash your hands thoroughly and also not to touch your face if you can avoid it. Could you tell us the reasons why those two things are so important now?
Yeah, so that's a great question about why it's so important to wash hands and not touch the face. And so with hand washing, we know from randomized controlled studies, which are our strongest level of evidence, that washing hands is very effective at removing pathogens from the surface of our hands and from preventing transmission. And the other thing that we know from these studies is that the observational studies show that people touch their face a lot of times during the day. And this makes sense because all of our senses are located there, right? Our eyes for seeing, our nose for smelling, our mouth for tasting, and our ears for hearing. So a lot of our senses are located on our face. And that's believed to be one of the reasons why people touch their faces so frequently. But observational studies have shown that people touch their face on average up to 20 times per hour. And one study that was done looking at church members for Sunday school and people in theaters found that they even, pick their noses as many as 1 to 3 times per hour in up to a third of the population. So a lot of people touching their faces. So the importance of hand washing then is that if we're going to be touching our face so frequently, so many times in a day, even if there's a small risk with each time touching our face, it's cumulative. So we have to be very careful with washing our hands. And so washing our hands and removing this self-exposure is one thing, but it also reduces our exposure of transmitting those pathogens or bacteria to other surfaces or to other people.
Right. Thank you so much. That really helps to understand. And also, the symptoms of the corona virus, infected individuals have a hard time breathing, coughing, and fever. Could you tell us, just in general, how fever is related to infection and what are the damages that could be done to the body when the fever is too high?
All right, I'll do my best to answer that. So fevers are a common symptom when our body is fighting an infection. And this happens because its components or parts of our immune system are responding to these foreign objects, to the bacteria and to the viruses. And some of those might, for example, be cytokines or macrophages. And what they do is that when these immune system components come in contact with these foreign objects, the bacteria and viruses, they send signals to other cells. They might say to the T cells, come and help out, or we need to clear this away. And so that fever then, some of these immune system components can travel to the part of the brain that regulates the body's temperature. And so the temperature may increase in response to that. And so the fever represents the activities and actions that our immune system is taking to fight this invading pathogen. And the fever itself may have some benefits in that there are some bacteria and viruses that are sensitive, very sensitive to temperature change and can't survive with that. So that's what the fever is doing, is that it has some direct effect on the illness, but it also represents what our immune system is doing to fight that. Now, in terms of when a fever can be dangerous, this very much depends on the age of the individual. So the fever guidelines for high fever are very different for infants and children than for adults. And it also depends on whether there are underlying conditions. Perhaps if the affected person has some other condition, autoimmune disease or immune deficiency or something else. And then it also depends on whether that fever occurs with other symptoms. So we all know with meningitis, a stiff neck, for example, or difficulty breathing. So in terms of the damage that a fever can do, I think it depends on the age of the person, the duration of that fever, and their medical condition. But people with a high fever with any concern should always contact their healthcare provider or their child's pediatrician.
I see. Thank you very much. And any other precautions we should take during this time? Like, we had pandemics before, but why the big emphasis on social distancing came up at this current time?
Good questions. I'll answer the first question. That's more straightforward in terms of the precautions we can be taking. So we've talked about hand washing, so doing it frequently and doing it correctly. So, the full 20 seconds, soap and water. Using hand sanitizer if soap and water aren't available. Reducing touching the face to the extent possible. So just being aware of doing it can help reduce that. Staying home if you're sick, of course. And we'll talk about the social distancing in a minute, but other things, just generally staying healthy. So getting enough sleep, staying hydrated with fluids, eating well, continuing with physical activity. And then, of course, if you can, to reduce or to stop smoking, because we know that's a risk factor for respiratory infection complications. So the next question you asked was about it was the difficulty breathing and why some people, the social distancing, that's right. So that's one of our preventive measures, the social distancing. And, we kind of have these measures. If you look at for flu recommendations, you are supposed to stay home if you're having symptoms, but it's especially important now because the severity of COVID-19, it really has a higher mortality rate. The case fatality rate is much higher than it is for flu. And then the proportion of people who get a severe infection, so the people who end up needing to go to the hospital with complications, who may need a ventilator for assisted breathing. So this, these severe complications and the mortality rate are much higher than they've been in the past for flu and for our typical coronaviruses. And so that's why we're being much more serious about the social distancing, is to try and prevent that case spread and the associated complications.
Right. And that's also related to flattening the curve.
Exactly.
Right. Yes. Well, thank you so much, Dr. Mehta. This has been a very useful episode, and I'm sure it will help many people understand the reasons why those precautions are being taken.
I hope so.
Yes. Have a good day and hope you stay safe too.
Thanks. Same to you and to your listeners.
Thank you.
All right.
And I will see you next time on Interview with Irene. Again, stay safe to all my listeners and stay healthy. Bye.
Bye.